Well, hello and welcome to our Zoom education session on an overview of Alzheimer's disease and dementia. Thank you for joining us for our discussion today. And our presentation is all about understanding dementia. This session aims to increase our understanding of the various types of dementia that do exist today, including both reversible and irreversible types. As well, we're going to talk a little bit about the symptoms of dementia. This presentation will also explore how Alzheimer's disease, which is considered the most common form of dementia, how it impacts the brain, and how it is likely to progress. My name is Sarah Cook, and with me today is Shelby Berry, and we are both education coordinators at the Alzheimer's Society of Peterborough, Kawartha Lakes, Northumberland, and Haliburton. We recognize that throughout the discussion today, there may be several questions that do come up. And so just in the interest of time, and because we're not always able to see the chat pod when we're sharing our screen, we would like to ask if you could just hold your questions until the end of the presentation. But we also don't want you to lose track of those questions. So feel free to, jot it down on a piece of paper, or you can even type it into the chat pod, and we'll be sure to review those questions at the end of our session. So we just really want to thank you for your help with this today. So one of the questions that we get asked most often is, what is dementia exactly? And how is it the same as, or how is it different from Alzheimer's disease? And dementia can be a very difficult term to understand because over the years, there have been so many myths and misconceptions about what dementia really is. And I find that it often helps to start off by defining dementia and to clarify what it means to live with it or to have it. So the term dementia has commonly been used like it's the name of a specific disease, but in reality, that's not the case. The term dementia actually refers to a set of symptoms, and these symptoms can occur when a person has either a disease or a disorder of some kind that is affecting their brain. And when a person has a disease or a condition that exists in or impacts the brain for a variety of reasons, which we're going to talk about in a little bit, they may demonstrate a range of symptoms. And those symptoms can include what you see here on your screen. So it may include loss of memory, it may include loss of understanding and judgment, as well as reasoning abilities. And where the clarification comes in is that Alzheimer's disease is in fact a disease of the brain that can cause the symptoms of dementia to happen. And in fact, Alzheimer's disease is the most common form, or you can also look at it as the most common cause of dementia. So we're likely to see when a person does have Alzheimer's disease that they will experience the symptoms that we're talking about here today. So the loss of memory, the loss of understanding and judgment, as well as various other symptoms. And Shelby's going to share some of these with us a little bit later. We also need to recognize that Alzheimer's disease is not the only cause of these symptoms. There are many other conditions that do exist in the brain that can cause similar symptoms, and that's what we're going to explore next. So the image on this slide depicts an umbrella shape, and we often refer to it as the umbrella of dementia because it really does help to explain that there's various types or causes of dementia. And so here in this image, we see dementia as that overarching umbrella term, and you can consider the spokes of the umbrella as what represents the different types or the different causes of it. So under the umbrella here, we've listed some of the most common forms that we do see, but we want you to realize that these are only a handful of the different types of dementia that exist. Some researchers and experts believe that there are now well over 100 different types or causes of dementia that exist in our world today, so that's significant. And of course, I want you to not worry, we're not going to be able to talk about all 100 of those different types of dementia today, but we at least wanted to explore some of the most common ones in more detail so that you have a bit better of an understanding of these conditions and some of the key features or characteristics of them. So as you know by now, just from what we've already mentioned, Alzheimer's disease is the most common form of dementia, and it occurs in approximately 64% of all cases. So clearly at this time, it is the most prevalent. It's the form of dementia that we are most familiar with in terms of overall knowledge, but it's also the type of dementia that has been studied and researched the most. The disease is named after the doctor who discovered it, and that's Dr. Alois Alzheimer. And it was discovered over 114 years ago. So it's been around for a lot longer than most people even think. That's all we're going to say so far about Alzheimer's disease at the moment, because after we talk about some of the other forms of dementia, we're really going to focus our remaining time on increasing our understanding of Alzheimer's disease. So we'll come back to this in just a bit. But first, let's take a look at some of the most common forms that we do see next to Alzheimer's disease. So this is a big word, and I know sometimes it's overwhelming, but it's called frontotemporal dementia. And it is another type of progressive dementia that occurs in about 10% of all cases of dementia. Unlike Alzheimer's disease, though, which generally affects all areas of the brain, as the disease progresses, or most areas of the brain as the disease progresses, frontotemporal dementia is an umbrella term for a group of disorders that primarily affects two particular lobes in the brain. And that's the frontal lobe and the temporal lobe. And so if you can see from the slide there, the frontal lobe is that light purple area behind your forehead, and the temporal lobes on either side of your head are the blue areas there, kind of tucked in over top of the ears. And these are the areas that are generally associated with our personality, our behavior, our emotions, our language and speech, our ability to use abstract thinking, and also it helps to control our movement abilities. So in most cases of frontotemporal dementia, brain cells in these areas start to shrink and die off, and that's causing some of the damage that we see. But in other cases, the brain cells in these areas actually get larger, and they contain these little tiny round silver structures called Pix bodies. And some of the researchers say that it almost would remind you of these little silver sequins. If that's the case and the Pix bodies are present, then the diagnosis is Pick's disease, or what is sometimes called behavioral variant frontotemporal dementia, and it's considered the most common frontotemporal disorder. There's several other names that come under the umbrella of frontotemporal dementias, depending, of course, on what parts of the brain they're affecting, and the brain changes that occur as a result. But in general, they eventually all lead to similar signs and symptoms that are associated with frontotemporal dementia. We're not going to get into listing all of them because they're numerous. The types are numerous. But if you would like any further information about the various types, we're certainly happy to point you in the direction of some great resources and information. So don't hesitate to ask. As I mentioned, frontotemporal dementia involves changes in an individual's personality and their behavior, and in addition, their judgment as well. So people with this type of dementia sometimes can act inappropriately around others, resulting in what could be potentially embarrassing or difficult social situations. In the early stages of the disease, behavior changes and problems with speech and language, they can appear separately, but as the disease progresses, those two areas often overlap, and language problems unfortunately progress further, and it affects the ability for the person's communication. So it affects their ability to communicate effectively. Now, another condition called Lewy body dementia occurs in about 5 to 15% of all cases of dementia. And it is a form of dementia that's characterized by abnormal deposits of a protein. And the protein is called alpha-synuclein, and it forms in and around the brain's nerve cells. These deposits were called Lewy bodies after the scientists who first described them. And you can see there from the image on the screen, it shows you what a Lewy body structure looks like. The process that leads to the formation of these Lewy bodies is unknown at this time. We don't really know what's causing it to happen. But the areas of the brain involved in thinking and movement appear to be the most affected in this particular type of dementia. Lewy body dementia can occur on its own, by itself, but it can also occur together with Alzheimer's disease. And sometimes it can also occur with Parkinson's disease. A person with Lewy body dementia may experience several symptoms. Many of the symptoms that we would come to mind when we're thinking of dementia, like progressive memory loss and problems with language, reasoning and higher order thinking skills, mental functioning such as calculations, but also it can result in depression and anxiety. It can result in visual spatial problems, and a lot of care partners report that they see fluctuations in that person's level of alertness. So that's a key symptom. And what some of you may know is another key symptom that's associated with Lewy body dementia are visual hallucinations. And they're a common symptom, and they often worsen during times of increased confusion or stress for that person. The visual hallucinations are often recurrent, and they usually consist of seeing or hearing people or children or animals. So it's not uncommon for a person with Lewy body dementia to report hallucinations involving those things. Unfortunately, for some folks that have Lewy body dementia, the progression can be quite rapid. Memory difficulties, while they can be a part of Lewy body dementia and they can occur throughout the progression, often memory loss is not the first sign in Lewy body dementia. It can be, but usually it's other symptoms that appear or become more apparent first. So generally the memory loss comes along a little bit later. And another key characteristic of Lewy body dementia is that the features of it can often resemble the physical features of Parkinson's disease. So a person may have that muscle rigidity, that stiffness of muscles. They may have tremors or shaking. They may have that stoop posture, that shuffling, slow gait that affects their overall mobility and ability to navigate their environment. It is now believed that some people that are diagnosed with Parkinson's disease may also have Lewy body dementia. So what I want to be very clear when I say this, though, is that it does not mean that just because you have Parkinson's disease that you're automatically going to develop Lewy body dementia. Okay, I want to be very clear about that. All it means is that some people that are living with Parkinson's may have a greater risk of developing the Lewy body type of dementia, just because they're very, very closely related in the way that they affect the brain. Now, vascular dementia is a type of dementia that's caused by damage to the brain from a lack of blood flow, or it can also happen if there's bleeding present in the brain. For our brain to function properly, it needs a constant supply of blood and oxygen through a network of little blood vessels called the brain vascular system. When the blood vessels are blocked or when they start to bleed, oxygen and nutrients are prevented from reaching the brain cells. And as a result of that, the affected brain cells can die. When brain cells die from lack of blood flow or from bleeding, then we see stroke symptoms that can result from that. And so vascular dementia can be a result of a stroke or a series of strokes, but it can also be the result of a condition called cerebral small vessel disease. And You probably are familiar with the older terminology that we used to refer to as hardening or narrowing of the arteries in the brain. And so that's what that cerebral small vessel disease does. It really can affect and cause long-term damage to the brain's blood vessels. If you think about stroke symptoms, right, they can include paralysis and loss of speech. And of course, the location and the size of the brain cell death determines really how the thinking and physical functioning of that individual will be affected. Someone with vascular dementia may notice kind of as their first appearing symptoms, they might notice that they have a challenge in their ability to make decisions, to plan, to organize. Those may be the first symptoms that appear, but other changes can occur as well. Difficulties with movement, such as a slower gait or poor balance, they may start to notice things like that. Symptoms in this type of dementia tend to appear slowly, okay? But specific impairments may occur in steps. So the person's abilities can deteriorate for a little bit, they can stabilize for a period of time, and then they can decline again. So we often refer to this as a stepwise pattern of progression. And it's different than the gradual progression in Alzheimer's disease. This happens in kind of that stepwise pattern. And there are now two different types of vascular dementia that experts have identified. The first is that subcortical dementia. So really, that's what we've been talking about. It's caused by that small vessel disease, where the small vessels in the brain start to become stiff and twisted, and that results in reduced blood flow to the brain. So that is problematic. The disease often damages the nerve fibers that carry signals around the brain through the white matter, and it tends to damage deeper areas of the brain as well over time. The second type that we want to note here is called cerebral amyloid angiopathy, and it occurs with Alzheimer's disease. It occurs when there is an accumulation of amyloid in the brain's blood vessels. And as we're going to talk about in just a little while, amyloid is the same protein that can accumulate outside of the cells in Alzheimer's disease, forming little plaques that can disrupt the brain functioning. And so when amyloid, unfortunately, accumulates inside the blood vessels, that's when we might see the strokes, the bleeding that can happen, and that can result in the symptoms of dementia. And finally, mixed dementia. And mixed dementia is exactly as it sounds. It has characteristics of both Alzheimer's disease and vascular dementia. But what's important to recognize is that we can have other mixed forms of dementia. So by definition, the term mixed dementia does refer to the combination of Alzheimer's and vascular, but it's not uncommon to have other mixings as well. So Alzheimer's disease and Lewy body dementia and Parkinson's dementia. So kind of what we've mentioned earlier. Researchers don't really know exactly how many older adults that are currently diagnosed with a specific type of dementia, actually have mixed dementia, but studies are starting to show that mixed dementia may be more significant, more common than we previously even realized. So some researchers are starting to say it may catch up with the percentage of Alzheimer cases. The concept of mixed dementia is really important because the combination of the two diseases may have a greater impact on the brain than either on its own by itself. And in terms of symptoms, it's a little tricky. It may follow a pattern similar to either Alzheimer's disease, or it can follow a pattern similar to vascular dementia. And what makes it even more complicated is that it could be a combination of the two. So, experts recommend that mixed dementia should be suspected whenever a person has evidence, really clear evidence of both cardiovascular disease and dementia symptoms. that slowly worsen over time. So that's kind of the thought behind how they're moving toward diagnosing or suspecting that type of dementia. So perhaps you remember earlier when we mentioned that there's over 100 different types or causes of dementia that do exist in our world today. And you may be wondering, how is that possible to have so many different types when, we're dealing with the brain, which is such a small part of our bodies? Uh, we just want to take that one step further and go back to that image that we had of the umbrella. And I want you to split that umbrella of dementia into two halves. Because what we want to discuss now are the two broad types, including both irreversible and reversible forms of dementia. So let's first get started by talking about the irreversible types. Some of these we've already discussed, so I'm not going to go over them again, but there are also some ones here that, that you may not be aware of. So first of all, the progressive disorders, like what we just talked about. Alzheimer's disease, Lewy body disease, and Pick's disease are all types of progressive disorders. So we know that they're going to get worse over time, that at the present time there is no cure, and that disorders like these will continue to, experience atrophy and change. The brain will continue to change, and the symptoms will continue to worsen as time goes on. So that's what we're meaning when we're talking about progressive disorders. Vascular dementia, just like we talked about, it's irreversible. It will continue to worsen over time as the blood vessels and brain cells continue to change and degenerate. We mentioned subcortical dementia, right, when we talked about the small vessel disease and how it can impact deeper areas of the brain. But often what gets lumped under subcortical dementia are other conditions of the brain, including Parkinson's disease and Huntington's disease. So those diseases can impact the brain and primarily affect the person's motor functioning. So those are all under that classification. Now, head trauma is an area that we haven't touched on, but head trauma, especially trauma that leads to loss of consciousness, can also create progressive damage in the brain that unfortunately cannot be reversed. There's no evidence currently that a single mild traumatic brain injury can increase that dementia risk, okay? But there is some emerging evidence and research that suggests that repeated mild traumatic brain injuries, such as those that can occur in sports like football and boxing and hockey and soccer, there's some emerging evidence that suggests that it could be linked to a greater risk of a particular condition that is now a form of dementia, and it's called chronic traumatic encephalopathy, or the acronym for that is CTE. So you may have heard a little bit about this in the news. They're certainly monitoring, the concussions that people that play sports experience, because CTE is a rising form of dementia. And of course, there's also irreversible forms of dementia caused by infectious diseases like AIDS or HIV dementia. Even though these are quite rare, it's still important to know that they can be progressive conditions that are irreversible. When people hear the term dementia, it can be really overwhelming because most people jump to that conclusion that it is an incurable condition. It is important to consider, though, that second half of the umbrella, to understand that not all dementias are caused by irreversible conditions. There are some conditions when the dementia can actually be reversed if it's appropriately acknowledged and treated. And so we're going to just quickly look at some of these forms so that we can be aware of them. The first is depression. Long-term or chronic stress resulting in depression can increase a person's risk for developing dementia. With stress comes chemical changes in the brain, and those chemical changes can eventually lead to depression and increase that person's risk of developing dementia as a result. If the person's depression, though, is addressed through therapy, through the use of medications to help stabilize the chemical imbalances in the brain, you will often see those symptoms of dementia reverse. Now, another key one are medications. Medications including things like sedatives, antidepressants, but also considering medication interactions. Those things can also cause symptoms of dementia to occur. So, combining prescription medications with over the counter drugs or supplements can also have a negative impact on the brain, and it can cause cognitive symptoms to occur. But if caution around taking medications is exercised appropriately, and if the type and the frequency and the dosage of the medication is evaluated properly by the physician and altered if needed, you will often see the symptoms of dementia reverse. Now, nutritional disorders, vitamin deficiencies and dehydration over a period of time can cause symptoms of dementia, particularly in our senior population. I always talk about the example of, the cup of tea and the piece of toast that becomes a senior staple diet. Uh, it is not enough to sustain that person, and their cognitive health. So many seniors experience cognitive issues because of the deficiency in their nutrient and fluid intake. Again, the dementia symptoms can be reversed if those balances in the brain are restored through better nutrition and increased fluid intake. That's key to note. Metabolic disorders. So, one of the most common metabolic disorders that looks like dementia is an undiagnosed thyroid disorder or undiagnosed thyroid disease. So it can cause the symptoms of dementia to happen, and most people don't even think about it unless they've had really extensive blood work. But if a thyroid disorder is detected through blood work, it can be easily addressed through either thyroid medications, monitoring, treatment, surgery, whatever may be the case. But oftentimes you'll see those symptoms reverse. There's also other conditions that can lead to the symptoms of dementia. Infections tend to be a huge source of those symptoms. So infections like a urinary tract infection or pneumonia can often cause dementia symptoms, but so can other conditions like brain tumors. Even severe constipation or impaction, it can happen. We see some folks in long-term care that are dealing with some of those challenges that can relate to symptoms of dementia. But if, again, these physical conditions are assessed and effectively treated, you'll often see those dementia symptoms reverse or disappear. The key takeaway here is that if a person is experiencing symptoms of dementia, it is important for them to see their healthcare provider to discuss what symptoms they are experiencing. If they worry and suspect that it's Alzheimer's disease, they may not always see their healthcare provider for the fear of getting that official diagnosis. And so they may put off notifying their doctor about those symptoms. The longer those symptoms persist, or the longer they don't report those symptoms, the longer those symptoms can persist. So we have to be aware that in some cases, they're being caused by an easily treatable condition and not something that's irreversible, like Alzheimer's disease. So I just quickly want to show you that umbrella image again. I'm not going to go over it in depth, but just so you know, if we split that umbrella in half, in the blue font there at the top of the umbrella, you see the reversible causes. And at the bottom in the red font, you see the irreversible causes. So no wonder, we start to see so many different forms that do exist today. Well, now that we've had a chance to increase our overall understanding of dementia and the various types that exist, I thought we would now turn our attention to focusing on and understanding a little bit more about Alzheimer's disease and the rest of our time together today. Alzheimer's disease is a progressive degenerative disease of the brain that leads to a loss of mental functioning. Okay, and that loss of mental functioning can affect the person's day-to-day abilities and activities. As we shared earlier, it's considered as a progressive form because the damage from the disease increases over time. And we're going to talk about how and why this happens in just a moment. It's considered a degenerative disease because over time, the brain cells actually degenerate. They shrink, they break down, they die off, whichever terminology you are most comfortable with to describe this unfortunate process. And as we noted, it is irreversible because at this present time, there is no known cure, and the damage that has occurred in the brain, unfortunately, cannot be repaired. We don't know how to fix it. So as we explained with, other forms of dementia like Lewy body dementia and Pick's disease, there's often physical changes, even with the vascular type, right? There's often physical changes that are occurring in the brain. And in the case of Alzheimer's disease, researchers and disease experts have identified and studied two hallmarks of Alzheimer's disease, what they call hallmarks. We like to refer to them as the culprits of Alzheimer's disease because hallmarks, that just seems like such a nice term for the severe destruction that they're causing. So Dr. Alzheimer, he first discovered the presence of these hallmarks way back in 1906. And the names of these two culprits are called amyloid plaques and neurofibrillary tangles. And we just like to call them plaques and tangles because, first of all, it's a lot easier to remember, and second of all, it's a lot easier to say. So we'll call them plaques and tangles. And let's start with the plaques and increasing our understanding of these little structures. So plaques are deposits of a protein in the brain that's called beta amyloid, or often it's referred to as A-beta. When A-beta molecules, which are sticky proteins, when they exist in the brain, which is a fairly small, compact area, those sticky protein molecules start to clump together in the brain. And they form these little plaques, as you can see there on your screen. Those plaques prevent signals from being transferred between the nerve cells in the brain, and they ultimately cause the cells to die. So in other words, these dense, irregularly shaped spots or plaques of amyloid take up the space where healthy brain cells function and communicate with each other. When they interrupt the signals being transferred between nerve cells, the cells die off because they no longer have another nerve cell to activate them. So that's why we start to see the brain cells dying off. And now we have the tangles. So tangles are little clumps, little fiber clumps of a protein called tau, which is spelled T-A-U. And tau proteins can be seen as these little parallel railroad tracks within the brain. Nutrients and other important material are transported along these little tracks, and that's what helps to keep the brain cells alive. In healthy areas of the brain, tau protein makes sure that those nutrients can reach their destination. But unfortunately, in unhealthy parts of the brain, the tau protein collapses and it starts to twist. It forms these little thread-like tangles, which prevent the nutrients from reaching the brain cells and ultimately choking out those healthy brain cells and resulting in the brain cell death. So essentially, these tangles are destroying the healthy brain cells that do exist in the brain. So as the disease progresses and these little plaques and tangles continue to destroy brain cells, the brain shrinks, which in turn affects the functioning of the brain. And the brain can actually shrink up to two-thirds of its original size and weight over the course of the disease, and that is significant. So although the onset of Alzheimer's disease is gradual, over time, Alzheimer's disease eventually affects all aspects of the person's life, including their mental and cognitive abilities, their emotions and moods, behavior, their ability to carry out those daily activities. And you think about it as this destructive disease is really being caused by these two little microscopic structures that can cause an extensive amount of damage. So just very quickly, I don't want to go into it too much in depth because we are not physicians, and so we definitely want to be able to show you the changes that are happening in the brain without getting into too much medical terminology. But Here, you can see the brain atrophy that can be caused by Alzheimer's disease. And this is shown through an MRI or a CT scan. You can see the healthy brain on the left and the Alzheimer brain on the right. And as you can see in the Alzheimer brain, there's a lot of darker spaces. And that's where we're starting to really see shrinkage and deterioration in that gray matter tissue. So it is significant. I also wanted just to quickly show you kind of a side profile, a comparison of what a healthy brain may look like, and over time, what advanced Alzheimer's disease can do to the brain. And, you know, when we look at an image like this, we start to see some of the dark holes and spaces in the brain. Where you see those dark spaces and holes, there's very little or no brain functioning happening in those areas. So I often use this image to show individuals and family members to help them understand, you know, that just because we can't see physically the changes in Alzheimer's disease, right? We can't see inside the brain. It doesn't mean that there's not significant change happening inside the brain. And you know, I'm always reminded when I see this image, it's amazing how well people with dementia do function, particularly with Alzheimer's, how well they function in light of all of this change. So I think this helps us to understand, it helps us to maybe remind us to be patient and helpful, and of course to take into account why the person may be acting or responding or behaving or communicating differently than they once did, because there is significant change that's occurring. And the last part of you know, talking about Alzheimer's disease really involves looking at the different forms of Alzheimer's disease. Did you know that there are different forms of Alzheimer's? The two main types of the disease are called sporadic and familial Alzheimer's disease. So we'll talk about those first, and then we're also going to discuss a condition that's called young onset Alzheimer's disease. So we'll get to that in just a moment. But the most common form of Alzheimer's disease is known as sporadic Alzheimer's disease. It has no specific family link. And it happens as a result of really a complex combination of our genes, but also our environment and our lifestyle. It's all of those things that are working together. And it usually does not run in families, and it's not considered hereditary. Age is the greatest risk factor for developing the sporadic type of Alzheimer's disease. And most sporadic cases begin after the age of 65. So, you know, we don't want you to think that just because we're aging that we're automatically going to develop Alzheimer's disease. But as we continue to age does play the greatest role in increasing our risk of developing it. Now, familial Alzheimer's disease is the second form of Alzheimer's disease, and it accounts for less than 5% of all cases. So families with this rare form of Alzheimer's have very strong family histories, okay? So in other words, it involves many family members over many generations that have had Alzheimer's. Familial Alzheimer's disease is due to changes in specific genes that can be directly passed on from parent to child. If a person has the familial type, their child will have a 50, or their children will have a 50% chance of inheriting this disease-causing gene and going on to further develop Alzheimer's disease. Familial Alzheimer's, it has the same symptoms as sporadic Alzheimer's disease, and it can develop at any age. Although we do see in some cases where if a family member has developed it, say at age 85, the next person in line in that family with familial Alzheimer's disease may develop it at a younger age. So that sometimes comes into play. Now, when symptoms of Alzheimer's disease happen before the age of 65, we use the term young onset Alzheimer's disease, or this was previously called early onset Alzheimer's disease. Young onset Alzheimer's accounts for an estimated 2 to 8% of all dementia cases. And while it is rare, while it can, happens very rarely, we do know our statistics show that 16,000 Canadians under the age of 65 are currently living with a young onset form of dementia. So people with young onset can, be in their 50s, they can be in their 40s, and in rare cases, they can even be in their 30s. So the important message here is that Alzheimer's disease is not an old person's disease. Yes, we do tend to see it in more seniors or people over the age of 65, but we are starting to see more and more cases of the young onset type. So lots of information there about Alzheimer's disease. I now want to turn it over to Shelby, who's going to share with us about some of the signs and symptoms of Alzheimer's disease. I'll turn it over to you, Shelby.
Thank you, Sarah. Can you hear me okay?
We sure can.
Okay, perfect. Okay. So in talking about the warning signs of Alzheimer's disease, this is an area that people often want to know about, but they also don't want to know about. So they're kind of interested in knowing about the warning signs, but maybe a bit hesitant in case they are noticing some of these warning signs with themselves or maybe with a family member. So just to kind of go over a couple of things before we go into each of the warning signs. These warning signs are not in any particular order. So I'll talk about them in a different order, but that doesn't mean that that's the order in which someone might present with some of these symptoms. So all or a variety of these warning signs could be present at any time for someone. And it's also important to mention that one or two of these warning signs, like experiencing one or two of these warning signs, to a lesser degree, can be common as we continue to age. So where it becomes more of a concern is that when we're talking about the 10 warning signs, if someone's going through them and noticing that they're experiencing 4 or 5 of them or even more than that on a consistent basis, so they're experiencing them more frequently over time, then this is usually when we would suggest that someone talk to their healthcare provider about some of these symptoms and changes that they're noticing. So as we look into more detail at some of the warning signs, so memory loss affecting day-to-day abilities. So it's normal for us to occasionally forget appointments or someone's name or someone's phone number, only to remember them a short while later. However, for a person with Alzheimer's disease, they may forget things more often, or they might have difficulty recalling information that they've recently learned. So they're having a hard time holding on to that information. So when the short-term memory loss persists and starts to impact someone's ability to function each day, so for example, if they're not remembering to take an important medication, let's say they have diabetes and they're not remembering to take their insulin, for example, or if they're not remembering to eat their meals each day, this is an example of how memory loss is starting to affect someone's ability to function each day, and it's wise to check with their physician. Difficulty performing familiar tasks. So we're all busy and distracted from time to time. So, we might make a salad for dinner and forget to put it on the table with everything else. But the big difference here with Alzheimer's disease is that the person's having a difficult time completing tasks that have been familiar to them for a long time. So maybe they're having a hard time preparing a meal, but that meal has been a family recipe that they've often made almost every week. And now they're starting to have a hard time with that recipe or making that meal. Another example could be if they've always enjoyed playing a certain game, they've played euchre each week with their friends, and now they're starting to have trouble, following the cards, knowing what trump is, and their nerves are some good examples. Problems with language. So we can all have a difficult time sometimes finding the right word to express what we want to say. this can be normal. But for a person with Alzheimer's disease, they may forget simple words and they may forget them more often, or they may substitute words in that don't really fit the context and make things more difficult to understand. So for example, someone might say, could I have a slice of coffee? And what they mean is, could I have a slice of cake? Or another example could be someone could end up describing the function of something because they can't think of the specific word. So they might say, can you take me to that place where they feed you? And we're kind of left guessing, do they mean the kitchen? Do they mean the refrigerator? Do they mean the dining room? So those can be some common examples of the warning signs there. Disorientation in time and space. So again, it can be common for us to maybe forget the day of the week if we're on vacation or we're retired, or if we're in the car going somewhere and for a second we're kind of like, well, where am I going again? If we forget that for a moment and it comes back to us, that's normal. But for people with Alzheimer's disease, they can become lost in, their neighborhood grocery store, or even in their neighborhood, close to their home. And they may have a hard time knowing how they got there or how to get home. So again, there's a big difference there in terms of kind of their ability to function day to day as well. Impaired judgment. So, from time to time, we can all make maybe questionable decisions that are out of character for us. But for a person with Alzheimer's disease, they may experience changes with their judgment and decision making that is maybe persisting or really, out of character for them. So an example could be they may not recognize a medical problem that needs attention. Perhaps they have a cut and they don't recognize that it's something that requires some stitches. Or they might wear heavy clothing on a really hot day, or shorts and a t-shirt in the winter. So, more unusual and kind of out of character for them. So impaired judgment can impose some risks to a person living with dementia. So we really want to pay close attention to this and in order to help them stay safe and keep their well-being in mind. Next, problems with abstract thinking. So abstract thinking is basically our ability to think about objects, principles, ideas that are not physically present. So for example, our ability to use and understand, metaphors, analogies, to use critical thinking for problem solving, our ability to use numbers, even our ability to think about the emotional impact of things on maybe our actions on someone else are all examples of abstract thinking. So from time to time, we may all have difficulty with tasks that require abstract thinking, such as balancing a checkbook. However, for someone with Alzheimer's disease, they may have significant difficulties with this task because they have a loss of understanding of, say, what numbers are or how they're used. So it's not uncommon for a person living with dementia to write an incorrect payment on a check that might cause either overpayment or underpayment. So say writing a check for $500 for a value that's really only supposed to be $50. Misplacing things, I think this is one that people often look at and think like, oh geez, I may misplace things often. Is that something to be worried about? Anyone can temporarily misplace a wallet or keys. We come home from work or going out and we're already kind of on to the next task and we don't really think through the task at hand of where am I putting my wallet and my keys. So later on, we might have no idea where they are. The difference here is that with Alzheimer's disease, a person may put things in what seems like an inappropriate or unusual spot. So for example, if you find an iron in the freezer or a wristwatch in the sugar bowl, that's more than just maybe mindlessly setting your keys somewhere. It's more of an unusual spot for you to find something like that. Changes in mood and behavior can also be common. So, anyone can feel sad or moody from time to time, especially in times of loss or times of stress. But for someone with Alzheimer's disease, they can show more varied mood swings. So it can range from calmness to tears to anger in a short period of time and for no apparent reason. Changes with personality can also be a common warning sign. So, our personalities can change in subtle ways over time. That's normal. However, a person with Alzheimer's disease may experience more striking personality changes. So they can become more confused or paranoid or suspicious or withdrawn. And the changes could also include things like lack of interest, fearfulness, or acting out of character. So family members may notice a change, like the person with Alzheimer's disease is becoming more suspicious. So they may think that the family member has taken something from them or moved something, when really the person may have moved that, but they just don't have that memory recall that they did that. And then the last warning sign here is loss of initiative. So, it's normal for us to tire of housework and business activities or social obligations, but usually after a period of rest, we regain our initiative and our interest in those activities. But for a person with Alzheimer's disease, they may become more passive or disinterested or need cues or prompts to become involved in activities that they didn't have any difficulty being involved with before. So it's not uncommon for the person with dementia who's always been socially active to begin to withdraw from social engagements and activities and show that lack of interest with continuing activities that they once enjoyed. So those are the 10 warning signs, and like we mentioned, if someone's noticing 4 or 5 or more of them happening more frequently over time, then this is when it's maybe more of a cause of concern and worth talking about with your healthcare provider. So before we finish here, we're just going to take a quick look at the different stages of Alzheimer's disease and the model that the Alzheimer's Society uses for these stages. So a common question that we get asked about Alzheimer's disease is how long can a person live with it? So as we've already discussed, Alzheimer's is a disease where brain cells progressively degenerate. And Alzheimer's disease typically follows certain stages, which act as an overall guide to understanding the pattern of the disease or how it's likely to progress. So because the disease affects each individual differently, the symptoms, the order in which they appear, and the duration of each stage can vary from person to person. In most cases, the disease progresses slowly and the symptoms of each stage may overlap, often making the move from one stage to another quite subtle and hard to distinguish. So in looking at the slides here, you'll see the stages early, middle, late, and end of life. So these are the 4 main stages of progression that the Alzheimer's Society uses as part of a non-medical staging model. So your healthcare provider may provide slightly different staging through a staging system called the Global Deterioration Scale, which describes 7 specific stages. But the healthcare provider may also use the terms mild, moderate, and severe Alzheimer's disease, which can loosely translate to the 4-stage system used here by the Alzheimer's Society. So it's important to understand that the length of these stages vary from person to person, but the entire progressive span of the disease can be anywhere from 2 to as many as 25 years, but the average is about 7 to 12 years. So in taking a brief overview of each stage, the early stage is a term that refers to individuals of any age who have mild impairment due to symptoms of Alzheimer's disease. So common symptoms can include forgetfulness, communication difficulties, and changes in mood and behavior. People in this stage often retain many of their functional capabilities and require minimal assistance, but they also may use things like memory aids like whiteboards, calendars, notepads, and timers. to help with that kind of memory loss and to help maintain independence. They may also have insight into their changing abilities and can therefore inform others about their experience living with the disease and be informed and involved in the direct planning for their future care. So the middle stage brings with it greater decline in the person's cognitive and functional abilities. Memory and other cognitive abilities will continue to deteriorate, although people in this stage may still have some awareness of their condition. We may also start to notice more changes in personality and behavior. And family members may spend more time trying to figure out what a particular behavior means or what the person with dementia is trying to communicate to them through their behavior, especially if communication through words has become more difficult. Assistance with many daily tasks such as shopping, homemaking, dressing, bathing, and toileting will eventually become necessary during the middle stage. And with this increasing need to provide care, everyone involved will need help and support during this stage. So that could be through family, friends, community support service programs, day programs, or different respite options. So the late stage of Alzheimer's disease may also be called the severe or advanced stage through some of the other staging models. In this stage, the person eventually becomes unable to communicate verbally or look after themselves, and care is required 24 hours a day. Many individuals in the late stage either have nursing care being provided within the home environment, or the person is receiving daily care in a long-term care setting. The goal at this stage is to continue to support the person to ensure the highest quality of life possible. And then the last stage in the model is end of life. So people in the final months of dementia will experience both increased mental and physical deterioration, and will eventually need, that 24-hour care as well. At the end of life stage, the person living with dementia may be able to speak a few words or may not be able to speak at all. And depending on the level, and this all depends on the level of impairment to their communication abilities. So as a result of this stage is often referred to as a period of complete withdrawal and apathy for the person with dementia. When the person nears death, usually palliative comfort measures become the focus. As in the care of any person living with a terminal illness, physical as well as emotional and spiritual needs must be carefully considered and attended to, and focusing on, quality of life and comfort here. So that was a quick overview of the warning signs and the different stages. If there's any information from that we discussed today that you'd like more information on, more detail since it was an overview, you can get more resources on our website listed here. Or you can also connect with either Sarah and I with any questions about resources, or connect with your client support coordinator to have that discussion about what resources are available to you. And then we also want to conclude today by saying that, we understand that living with and supporting someone with dementia is not easy. And we want you to know that you are not alone and that the Alzheimer's Society is here to help you through our staff and our programs and services. So we have a range of supportive services designed to assist you in your journey. So please do not hesitate to connect with us if you have any questions, again, about information or resources, or if you want to speak further with your client support coordinator about anything that you're going through. So we want to thank you for joining us today for this overview, and we're wondering what questions you might have about our discussion today. So I guess I best if I unmute you for that. And I also recognize it's 11:03, so if you have to run and don't have time for questions, that's okay, but we are going to take the time to address any questions that have come up.
I have a question. Do they do a test to see if the person with Alzheimer's also has Lewy body disease, dementia?
Want to take that, Shelby, or?
You can go ahead, Sarah.
Okay, so it's hard to say. It really does depend on the physician and what evidence that exists to kind of support that probable diagnosis they're making. Do be aware that when a physician makes a diagnosis, it is always a probable diagnosis. It's so hard to be able to understand, you know, all the ins and outs of what's going on in the brain definitively. So what I'll say to you, Kathleen, is that an initial diagnosis may occur of Alzheimer's disease because there's enough evidence or symptoms or perhaps assessment results or, you know, results from the MRI that kind of point in the direction that they're looking at a probable Alzheimer's diagnosis. But it is not unusual for that person to continue as they progress and start to show different symptoms. We always encourage kind of those 6-month follow-ups that you may have with the healthcare provider. If anything is changing, we advise people write down those symptoms as they're changing, because that's something you want to bring up at the follow-up. It is not uncommon for a person to be reassessed or for an additional diagnosis to be added. As we start to see those changes in the brain increase, we may see more symptoms. And so you being the care provider, you're in the best position to see those changes and to alert the doctor of those changes. You know, you think about that medical appointment that they have, it depends on the length of time, but the person may not always demonstrate those symptoms, but you may become very aware of them and think, oh, this is...
I find personally, once you get diagnosed with Alzheimer's, that's it. Boom, you have Alzheimer's. But in hearing this lecture, I could tell you Albert also has Lewy body dementia, definitely. And also, he was also diagnosed with Parkinson's because of the rigidity and all that. So he has Lewy body and Parkinson's and Alzheimer's. And according to the stages, he is in the final stages. He's in the final stages. Now, his dementia is also familiar because his two brothers have it. Actually, his third brother hasn't been diagnosed, but he has all the symptoms. I see it. So the 3 boys have it. The father had it. And one other brother, was 8 of them in all. And one other brother was diagnosed with a mental disorder. He had a nervous breakdown, and he was in a mental hospital. So, it could be that his symptoms were overlooked, and it was classified as a mental breakdown. Absolutely. Instead of what it really is. Yeah. So that also told me that he is it's their genes. It's part of their family.
Yeah, that's a perfect example of how we see that familial aspect come through, you know, when there is a strong connection in the family. Was the physician aware of that? Is the physician aware that there is that familial history?
I don't think so. Because Albert, he does not talk about his family and stuff like that, but I'm aware of it because I know their wives and I know the story of the other brothers that have it. And a couple of them that have it, they, how should I say this? They're in denial. Okay. The one brother, he goes on his bicycle and I ride 25 miles a day, and he's, jumping around like if he's a rabbit almost. And his wife says he is out to lunch, he he doesn't remember anything. He carries on about like he's in la la land, in other words. He's not he's not accepting what is happening to him. And even Albert at this final stage does not accept what's happening to him. Just last week he said to me, he says, what are we doing for vacation this year? I said, Albert, you're in a nursing home. There will be no more vacations. We're not going anywhere.
And sometimes, Kathleen, the hardest part about the disease, some of those symptoms, it often causes them to lose that insight. So, you know, as Shelby talked about, early in the disease, people sometimes do have that insight into knowing what's changing, but the frontal lobe is where that insight is housed. And if that part of the brain is being affected, as it usually is in the earlier stages, you start to see them lose that.
He definitely has that frontal lobe dementia because it started early with him with being inappropriate, saying inappropriate things to women. And I was like, what are you saying, Albert? Don't say that. This is sexual harassment now. You know, like saying, oh, I love your hair, or, you know, stuff like that. Like, really, what size is your bed? Is it a queen size bed? Like, and I used to be so embarrassed. And then I'll tell him, I think he has frontal lobe dementia. Like, you know, excuse him. And then, what's her name from Alzheimer's said she would give me those little cards.
Yeah, we have companion and compassion cards, which
but I never got them, but now I don't need them because he's in the home.
The long-term
care. But I'm just trying to say that how many things have been just not depicted, and by just talking to you, I could tell you all these different things that I know he has.
Absolutely,
and they were not diagnosed.
Yeah, and it happens because, you know, some physicians are quite comfortable and they understand a lot about dementia in the brain. Others may make that referral to a specialist who understands more. But again, you know, the initial changes that may happen, they may make that probable diagnosis. And unless they revisit it, which is why I always say, you know, family members.
Never revisit it after that.
Yeah, like
once they say you have dementia, you have Alzheimer's, that's it. You're done. You know?
So I have seen some of our clients that have questioned it. They will go back to the physician with their new findings, with the new symptoms. And sometimes they will either add on another diagnosis, like a mixed dementia, or they will change that. I've had people experience an Alzheimer's diagnosis and then have it changed to a Lewy body diagnosis as they start to see more of those symptoms or degeneration appear in the brain. But it's hard. I think it's hard sometimes for physicians because there's still not a perfect way to see inside the brain and to know all of what's changing. So they have to rely on different ways of assessing. They have to rely on your observations. So it can be tricky, but you're right, Kathleen. It can be very frustrating because when they do get that diagnosis, sometimes it's like, okay, you've got your diagnosis. This is what you've been, you know, identified as having, and we're not going to look any further. And that can be a little unsettling because some people will ask, they'll say, does it really matter what type of dementia it is? And I always say yes and no. I'm going to give you the ins and outs of both, right? Sometimes it doesn't matter because if the symptoms are going to be very similar, you know, it's all about addressing or trying to meet their needs. But in certain cases, like if it is a Lewy body dementia, we may need to know that because that may affect their physical abilities. Another key finding with Lewy body dementia, for example, is if with the hallucinations, sometimes a doctor may prescribe medications to help with the hallucinations. But in Lewy body dementia, if you prescribe certain medications, it can actually make the symptoms worse.
Hello.
So we need to often know what we're dealing with there. Yeah, sorry.
With him.
Oh, sorry, Kathleen, go ahead.
I just saw somebody named Joyce.
I think Joyce might have answered the phone or something.
Okay. Okay.
I guess.
Yeah, okay. Joan?
Thank you. Kathleen, what you're saying is very familiar to me because my friend had Lewy body, but I'll just tell you my experience. It was diagnosed as Alzheimer's for about 3 years. And then the Reminal meds started to wear off. So they changed the meds and he really started hallucinating. And like you say, it gets worse before it gets better, and that's what I asked the doctor. And then he actually consulted specialists and called me at home and said that it's been a misdiagnosis. It's Lewy body, and it is the genetic one. Correct me if I'm wrong. And so I read a lot on it. Of course, after that, Frank's mother had it. He was in total denial, as you're experiencing. He just said, I'm going to wrestle this to the ground, and we never talked about it throughout, which was very difficult. So I feel for you. I really feel for you. But it seems like they don't diagnose us at the beginning. As you say, maybe they're not all that familiar with it. It's kind of a new thing and a specialized thing, but that's what we had. And so we had to take him off that med and try to balance what would work. But the hallucinations got worse with that med.
Albert's hallucinations are off the chart. Off the chart. He thinks that robbers came into his room and stole his computer, and he thinks he's seeing birds flying around, and there's raccoon in his bed, and oh my gosh, it's horrible.
And it's so tough too, Kathleen, because their brain actually sees it. You know,
I know.
we can
for real.
Yeah. And we can try to say to them, try to help them feel safe by saying there's nothing there, but it doesn't matter because their brain is telling them that it's there. So it's very, very real to them. Yeah. And, you know, that's a very tricky situation with the hallucinations. So, you know, that might be something like, do they also recognize that? So with being in the long-term care home, are they helping to address some of those hallucination concerns? Or
he gets very restless at nights.
Right.
And he falls a lot as well. So they give him medication to keep him quiet, to kind of, you know, and that, I think that medication causes him to hallucinate.
And that's what I mentioned, right? Is that sometimes the very medications they give to help calm the behavior makes the hallucinations worse. Yeah. And, you know, just to be fair too, to say some forms of dementia will cause hallucinations. You know, it's not unusual. Like some people, and Alzheimer's, you can have hallucinations, but the key component, the really key symptom that really stands out with Lewy body dementia, it's the hallucinations that are increasing. And they definitely, if you notice them getting worse when he's more confused or more stressed, hard to deal with that.
It is funny. I have never thought about this, but when the moon is full, they're all in there. They go nuts.
That's so right. Absolutely.
They go crazy. Yeah. I never thought that the moon really had an effect on people with problems, like mental diseases. But they all go wacko for like 2 or 3 days around the full moon.
I hear that commonly, and you mentioned it too, Diane, right? That you see it. We do a lot of work with long-term care and retirement staff, and they often will say, you can tell, Sarah, it's a full moon because the behaviors are usually here, right?
Yes.
And it's hard when you're not only dealing with 1 or 2 behaviors, but you're dealing with the vast majority.
I was there one time when it was a full moon, and I could not believe what was going on. Everybody was crying out loud, I want to go home. Take me home, and calling out for their husband and this one. And I said, oh my God, what's going on? And I asked the nurse, I said, what is happening? Like, it used to be so nice and quiet. She says, the full moon.
Yes. Yeah, interrupting those, I guess, natural rhythms of the body or something, you know, but I've heard many people comment that. Diane, did you have a question?
Yeah, actually, I don't know what the other homes, but our home, where once a year get a care conference. And because I couldn't win, I couldn't be a part of it. They did it with the staff, and then the nurse called me afterwards to discuss it. There was so many things, like, I mean, Brian has deteriorated. incredibly. It's just rapid. And I said, I want a copy of this because I'll remember it all. It was like 9 pages. And so I said, I want to copy of this because I'd like to compare it to last year, or hopefully if he's around next year, I have to refer to. And it was as of July 2020. He's completely dependent on care. He can't even brush his teeth. Dressing, toileting, feeding, like it's incredible. I haven't been with him since March, so I don't know. I have seen this, but when you see it in writing, it's just, I don't know if he's in final stage or at end of life. It's hard to say. He's down to 13. He's still walking.
Oh, he's
He's
walking?
not in a walker or wheelchair.
Oh, well, that's
He's
good.
got Lewy body, Parkinson's disease. He's only 70 years old. He's fallen a lot. You know,
That's
all the
young.
same symptoms that you were saying. But it's just, I don't know what stage he's at. I don't know. I guess it doesn't matter. He's when he was diagnosed by Dr. Ingram in 2015, she said that she could see in a nursing home 2 years, which was 2017 he went. And then said to me, she said, he's further along in disease than I thought. She said, I thought, you know, he might have 10 years, but she's more advanced. So she said, I give 5 years. So this is his 5th year. And I haven't been with him for 6 months almost. It's just heartbreaking.
Yeah.
You know,
How have you been making out with the visits now with the new COVID guidelines? Are you able to go in and visit?
I have one visit once a week for half an hour
Yeah,
in
it's
the
same here.
courtyard.
Yeah, that's
If
the
you
same
go
here
in the
with me.
building, you have a COVID test. I
Well,
choose to be outside.
Before it was a COVID test outside. Now you don't need the COVID test outside.
I know.
But to go in, you need a COVID test. But I don't, honey.
And
I
I
had
want him
3,
outside to visit.
and I
He
don't
has
want
be
to go in. I
outside.
really don't want to go in.
no, that's
I
understandable.
don't want to go in either. I really don't.
I don't at all. I don't know what
And
we're gonna do when
I
it
had a
gets
visit with
cold.
on Sunday and have to sit 6 feet apart at the
Yeah.
table.
Yeah.
And before I went in to sign and have my temperature taken, they brought out and he actually see without my mask on. He looked right at me and was walking right towards me really quick. Like he recognized me. And I'm thinking, oh God. So they took him and they dirted him and sat at a table so he couldn't get near me. And then I said to him when we were having our visit, I said, what would you like to do today? And he looked at me and said, near. So to me, he wants to come near me.
Yes. Yeah.
No,
Yeah. I haven't
I
been
mean,
able
I
to
knew
take
what
his
he
hand
meant.
either. Yeah. It's hard. It's very hard. It's horrible.
I know. I wish
I
I
went.
could be
I
with
had a
him
2
more.
o'clock appointment yesterday, and I got there, and it was torrential rain, so I couldn't see him.
Oh no.
So I'm
Oh,
gonna try and see if I could get to see him today. I'm not sure if there's a slot because I'm an outside visit.
Yeah.
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 Is
Yeah.
your person
He
in
does do good
present
with phone
care?
visits because he doesn't understand. He can't hear me. He's not
Oh.
looking. Like, that's out. So it's just yard visits. I don't know what I'm going to do when it gets cold.
I don't know
I
myself.
really don't want to there.
I had 3 of those tests, and the last one was hell. The first 2 were easy peasy.
Oh, the COVID?
Yes. I had 3 already because I had to have a test to see him outside. So I had 3, and
Wow.
the first 2 were, I thought, oh, this is nothing. The third one, oh my God, it was horrible. It was so painful. And I think it was the nurse because she shoved that thing down. I felt it all at the back of my throat. and it burned, and I had a headache for 2 days.
Oh, no.
Yeah, so I don't know. I don't want to have to do that again. I'm hoping that the
I
rules
haven't had it.
change.
I'm just dreading it.
I don't know.
Yeah. Yeah.
Well,
I don't know how, I know the residents, they have to have, I don't know how they deal with,
they have to every 2 weeks.
but
It's
anyway,
only good for 2 weeks, so that's 2 visits. You know, it's hard.
Mm, such, you know, all these things that we would have never envisioned before COVID, right? It makes things so
Yeah.
much more challenging and difficult when we're already with a very
It's a
challenging.
whole new world. It's a
Yes,
whole new world.
it is.
yeah, it's just horrible.
Well, ladies,
Just horrible, horrible.
does
Well,
anyone
thank
have any
you.
other questions or
No,
comments about the topic today?
no, I'm good.
Again, we just want to remind you that if you're going through those particularly challenging times, don't hesitate to reach out to us or to your client support coordinator, because we want to try to help you, you know, through this difficult time, and we want you to know you're not alone through it either. So I know it feels that way sometimes, but please don't hesitate to reach out to us. We're always happy to have those one-on-one talks with you, or to offer any other resources or information that we can to hopefully make things a little bit easier for you. So,
Thank you.
okay. Well, thank you so much, everyone, for your participation today. I do hope that the information was helpful, or maybe you learned a little bit more about the different types of dementia, maybe that you didn't know before. But hopefully, you know, you have some great takeaways from today's session.
Yeah, I do.
Any
Thanks,
final
Lisa.
words, Miss Shelby?
I think just mentioning that next week's topic is self-compassion for caregivers. So
Good.
Anne-Marie's covered a couple of education topics for us so far, and she'll be doing the presentation next Tuesday. So, you know, we've been talking about how difficult these times are, and you know, we might get down on ourselves and be hard on ourselves. So I think it's a very timely topic that we kind of take a look at self-compassion and how it can be helpful for us. So it's next Tuesday, same time, with the specific link that we send out in the email. So I
Okay.
think you're probably signed up, but if you aren't, just send us an
I did.
email and we'll get you signed up.
Okay.
Okay.
Thanks very much.
Thank you.
All
Well,
right.
have a
great day.
wonderful rest of your day, and
Thank
hope to
you.
see you
You
again.
too.
Okay. Thanks, everyone.
Goodbye,
Thank
everybody.
you.
Good luck.
Bye.